Good afternoon, everybody. Good morning, good evening, wherever you're watching us from. Today's episode is special. In this episode of the Global Health Uncensored, we are very honored to welcome the newly appointed President and CEO of Vital Strategies. Dr. Marianne is a distinguished leader in global health, recognized for her extensive contributions to advancing women's health and health equity globally. She now leads an organization with a significant impact in public health, reaching over 3.3 billion people through its initiatives. Dr. Marianne's remarkable career includes her tenure at Merck, where she spearheaded the Merck for Mothers initiative, improved maternal health for millions of women worldwide. At Merck, she first served as the lead and executive director of Merck for Mothers and later as associate vice president for health equity, where she developed the company's first enterprise-wide health equity strategy. With an MD and MPA and MBA from Yale University, her expertise spans public health, clinical research, and health equity. Join us today as we are going to explore her journey, her vision for the future, and the critical role that health equity plays in addressing today's global health challenges. Let's welcome our special guest. Dr. Etiebet, thank you very much for making the time. I know how busy you are. Thank you so
Yeah,
much for joining us on this Global Health
yeah.
Uncensored episode.
Thank you so much for having me, Banda.
Yeah, so we all heard your recent announcement. Even before we dive into the main podcast discussion, could you tell us a bit about your expectations for this new role and how you're going to fit in this new appointment as a president and CEO of Vital Strategies? First of all, congratulations for this appointment.
No, thank you so much. I am just so honored, to be the incoming CEO and president of Vital Strategies. Many of you will know it as such a consequential global public health organization, that's focused on helping to build strong public health systems that protect everyone everywhere.
Hmm.
I know the organization from previous board service on it. And so I'm just really excited to be taking this role on and to help steer it and guide it, into the next phase of its evolution.
Awesome. So yeah, so let's start from the
Mhm,
the the beginning.
mhm,
How has your story or
mhm,
your career, early life,
mhm,
how has
mhm.
these experiences
Yeah,
led you to a career in
yeah,
healthcare and health
yeah,
equity?
yeah. Thank you for the question. I don't know how many of your audience may know, I was born and bred, as they say, in Lagos, Nigeria. And so I don't think
Not
growing
Ghana.
up, not Ghana, Nigeria, no, they carry last, except maybe for jollof rice, but Lagosian all the way. And you can't grow up in that type of a mega city and not be aware of the gross inequities that you see all around you. I remember, one particular moment driving to school. Lagos is known for its traffic. We were
Mm-hmm.
sitting in traffic and there, people selling things on the street. I noticed a girl, she was probably 13 or 14. She was carrying a tray, of fruit on her head, selling fruits, to folks, who were stalled in the traffic jam. But what struck me about her was she had, what we call in the vernacular bow legs, which is that skeletal deformity that's created from rickets, the nutritional deficiency. And it just looked so painful for her to walk. She had to swivel her hips to walk. And she was holding the hand of a young boy who was probably her brother, and he was in a school uniform.
Mm-hmm.
And even at that young age, I was probably 10, 10 or 11. There was something that struck me as inherently unfair, about that image. And that kind of intersection between health, between gender, between education and economic opportunity, I started to see, some of the linkages, and that planted the seed for focusing on health as a way to address some of the inequities that I saw, all around me. And so that, that really started my professional journey. It's always one that has been informed by the fact that when people don't have access to health,
Mm-hmm.
they don't have the ability to live their fullest lives and really chase and capture, opportunity. Mhm.
Yeah. Yeah. So going back to your early
Mhm.
academic life. So
Mhm.
you started basic education in Nigeria.
Yes,
Um
yes.
okay, so at what point did you move to the US
Yeah.
for your MD and
So
MBA?
yeah, so I came to the United States for college, and I like to say, I've kind of been here, ever since. I did a BA in political science at Yale University. At that time, in the 90s, you will have known that, the HIV/AIDS epidemic was
Mm-hmm.
ravaging the continent. And so I recognized that addressing that epidemic wasn't just about health, wasn't just about what happens in the four rooms of the exam room, four walls of the exam room, but it was about human rights. It was about culture, it was about stigma, and so. I felt that it would be helpful, to not just pursue an MD, but to also pursue an MBA, because so much of health, means that systems need to work,
Yeah.
in order to deliver health to the people. And we know, coming from resource limited settings, that financing, is a critical factor in being able to bring high quality healthcare to the last mile and to those that need it. And so that, that kind of informed some of the educational opportunities I pursued. Eventually, I did my fellowship in infectious diseases. I joined the academic faculty at University of Maryland, and helped lead and build some of their clinical HIV/AIDS programs as a PEPFAR implementing partner back in Nigeria. And that was really baptism by fire. We were in the trenches. We did everything.
Mm-hmm.
I just can't imagine kind of, that was real life education, as they call it, experiential learning to the fore. But it was also an amazing time because you realize that, with colleagues who are also as passionate and committed as you are,
Mm-hmm.
with financial support, with partnerships with the communities, as well as people who were HIV positive, that you could do, so much. And so, it wasn't just about programs, it was about policy change, it was about medical education, it was about supporting community-based organizations, it was about, reducing stigma, so many things that really spoke to, if you want to improve health outcomes, you really need to engage within broader society, in order to make sure that you are addressing, all of the drivers and solving for the multiple intersecting drivers of poor health.
Yeah. So it's interesting how you have an amazing background.
Mhm.
Really, did a lot of clinical implementation work. But at what point did you decide to focus or specialize on maternal health
Mhm.
and healthcare delivery? What are
Yeah.
some of the key moments in your career that shaped you to take this path?
Yeah. So great question. And what I would say, and I say this to, a lot of the folks that I mentor, is, you may start out with one vision and, kind of one idea of a pathway. But at the end of the day, it's really about recognizing and seizing opportunities and sometimes creating your own opportunities. So if somebody had told me, back when I started that I would be leading Merck for Mothers, a $500 million global health initiative around reducing maternal mortality, I would have been very surprised, that that was not necessarily in my understanding of my trajectory.
Mm,
But I'll share with you, some of the things that led me there, and again speak to that interconnectivity of all of the work any of us who are working in public health or global health experience on a day-to-day basis. While I was in medical school, I had the opportunity to work in Kailicha, which is a township outside Cape Town in South Africa. Kailicha, Western Cape, was the first place on the continent that received antiretroviral drugs
mhm,
for the prevention of mother to child transmission. And so the first kind of research work that I did was around the acceptability of prevention of mother to child HIV transmission programs, and really listening, speaking to and listening to the mothers and having, their experiences inform the program. And so, from the get-go, I saw that, one, maternal health was such a huge part of, our primary health systems, but also we weren't treating the mother at that time. We were just treating to prevent, transmission. And again, that was something that, also struck me, as not good enough. That, we also needed to make sure that we were treating and taking care, of the mothers. And so, I think that the other way that working on maternal health is such a window, into addressing health equity, is because in so many communities, the first and only time people and families are interfacing with the kind of health system, the formal health system, is when they're pregnant and giving birth. And so it's really an opportunity to engender trust, in the system. So people come back and they can be set up for a lifetime of health and well-being, and not just mothers, but their children and their broader families.
yeah. So, I mean, you've been in the global health space for over 2 decades.
Mhm.
S- how have you seen the global health space change, especially when we talk about underserved or
Mhm.
underprivileged populations?
Yeah. Yeah. So I think the tragedy, Manda, is that it actually hasn't changed. It hasn't changed very much at all. Not only do we continue to have these huge inequities, not just between countries, but also within countries, and
Hmm.
and in many cases, those inequities are actually, that gap is getting larger, not smaller. I think the other thing that is, also disappointing is that many of the issues that we were dealing with, 20 years ago, we're still trying to solve for now. How do we make sure we are paying healthcare workers, including community healthcare workers, a living wage? How uh, do we make sure that we are treating the whole person, not just, multiple things, or, multiple issues that they may be dealing with, but also over time, instead of just treating, one condition or one disease. I remember, again, going back to, my early days, working in HIV, we would make mothers come back to the clinic like 4 out of 5 days a week. One day they would come for their HIV appointment. One day they would come for their lab testing. One day they would come for their prenatal visit, and another day they would come to join a group counseling session. Um, you know, how can we expect folks to spend 4 out of 5 days, just lining up in the clinic? They have responsibilities. They have, many of these folks meant it was giving up, wages, to come to clinic. And so I think that we still need to do a better job of making sure that the work we do in global health is seamlessly integrated when it interfaces with the patient or with the individual. Yep.
And I also see that part of what you're very passionate about is really in the space of health equity and bridging the gap of the health equity. Um, in your opinion, how can we effectively bridge, these health equity gaps in under-resourced regions, and what strategies
Yeah.
have proven successful based on your
Mhm.
2 decades experience?
Yeah.
And what do you really want to see more of?
Yeah. No, so that I would probably need a lot more time, to get through all of that. But, if I could, summarize in terms of, health equity, I think it's not just what we do,
Mhm,
it's how we do it. Because when we think about health equity, we want to make sure the impact of our work sustains, is enduring, is long lasting. And I
mhm,
do believe that unless we change how we do our work, then there is there's a very high probability and high risk that whatever incremental gains we make, in reducing disparities in health outcomes, they're not going to be durable. And so, at one point I had been thinking about, what does this mean in practice? And kind of came up with, an acronym, EPIC journeys. E stands for equitable, P stands for proximate, I stands for inclusive, and C stands for collaborative. And I think if you are working in global health and you, by nature, of the work you do, you have to partner, but you have to make sure that those partnerships are epic. They're equitable, proximate, inclusive, and collaborative. And what I mean by that is, when we think about equitable, it means that the distribution of resources, is equitable, and is going, to where it is needed the most. When we think about proximate, it means actually the leadership, for these programs. This work is as proximate as it can be, or to the folks who are, who are meant to be served.
mhm,
Inclusive, it means that we make sure, through our partnerships, we're including everybody that needs to be at the table, including those with lived experiences. And that's kind of informing what we do, how we do, and how we hold ourselves accountable. And then, of course, collaborative, because I do believe it's the diversity of experiences that actually allows us to find, the best fit solution and the fit for purpose solution for many of these challenges. And so, what I have seen is that when we make sure that people with lived experiences have a seat at the table, that is what creates the sustained change. Because, by dint of them being there, they're able to surface the specific challenges and issues that had perhaps been invisible before. And they are also the folks most knowledgeable about what's going to work to actually change outcomes. So, when I think about, how we continue to drive towards equity, it really is about changing how we work, and making sure that, those who are closest to the issue and affected by the issue are participating in designing the solutions, driving the solutions, and dividing the resources.
Hmm. Yeah, and I think you've made a very important point, especially in a resource limited setting
Yeah.
like Africa. Getting community involved in the early planning and decision making process is such a crucial step.
Yeah.
And one of the uh, initiatives that you've led that has become very successful is a Meg for Mothers. And since 2011, this program has impacted more than 30 million women globally. Can you share some of the key strategies and partnerships that have been crucial to achieving
Yeah.
these results?
Yeah. No, thank you. And, I just want to say, again, how honored I was, to be a part of that program and really Merck's, huge commitment, to addressing mortality globally. And, the team and our partners, who really are the ones, who deserve the kudos, for all of this impact. What I would say about, some of the ways that we've been successful. And I say that humbly because we still have not solved the problem of maternal mortality, and um, in many places, including the United States, again, the disparities, are widening. As it is right now, we're not going to get to the 2030 SDG goal, unless we do something drastically different. But what I would say in terms of some of the drivers of our success has been around, making sure that we are surfacing, elevating the inputs and the voices of women, who've had these experiences, because they are the ones who know what's going to work best, for them and in their communities. I think the other piece of it is the data piece. For so long, we weren't actually counting maternal deaths. We had no idea how many people were dying, who was dying, why were they dying. And I think if you don't count, you're automatically saying that this person or this issue has no value. And so we did invest in a lot in data, making, what was invisible visible, and making sure that that data was used to drive advocacy for policy, as well as to hold all of us as a community accountable. I like to say, it's the stories that pull us into this issue, but it's really the data that drives us, and informs our action. I think the other thing that I really was proud of in terms of our approach was really thinking about focusing, so that we could build strong relationships over time. Because for public health work and global health work, you are not going to see durable results, in 1, 2, or even 3 years. You really have to be committed to this, for 5, 10, 20 years, and have the patience to do the foundational work and the foundational investments that will sustain, any success, and so I think it's about really developing trusted relationships, with your partners, and making sure that you are partnering across sectors, and you're bringing people who maybe traditionally had not been involved in this issue or in this fight to the table, because at the end of the day, there's always something that somebody can contribute.
Awesome. And I also, read that. So, in your previous role as the associate vice president for health equity, um, what what are some of the major challenges and opportunities that you've encountered, for example, in advancing health equity, and
Mhm.
how can
Yeah.
organizations address some of these
Yeah.
issues?
Yeah. So actually, I will link it back to your previous question. I'm sure you are aware that sometimes in the global health community, there are certain ideologies or presumptions or assumptions or understanding of the role of private sector. I think many people think that private sector is part of the problem, and not part of the solution. I do think, in the 7 or 8 years, I have been, working in global health, from the private sector, that has changed, because, first of all, I don't think you can paint, private sector is big. It's diverse, it's varied, so I don't think you can use, one term to, paint, one brush to paint, a whole sector. Um, but I do think that there are a lot of different efforts coming from the private sector, that have proven over time that they actually not just can be a part of the solution, but they are an integral part of the solution. And when you ignore the private sector, for example, we're from, Nigeria and Ghana. We do know that in many places, up to 40, 60% of people are receiving their care from the private sector. And so if we ignore that, that means there's 40 to 60% of people that we are not addressing, their issues. And so, the other thing I like to say about the private sector is it puts the sustainability, into the SDGs, because, for all of this work, you do need to be able to support it, and to make sure that it continues, and that it creates value. And I do think that private sector really can be an engine, for sustainability for a lot of this work. And so, to come back to your question, when as a company we looked at, the impact we were having in the maternal health space, we asked ourselves, is there more we can be doing to drive health equity, and not just in maternal health, but in areas of health, that, we were also engaged in as a business. And could we think about how private sector can advance health equity, not just through its philanthropic efforts, but actually, as part of its business, as part of its business strategy, as part of its engine of growth? And I like to talk about this notion of inclusive growth, because when, as a company, you see everyone, as a potential patient, or consumer, and you actually, go after trying to reach, everyone, I do think it changes how you think about growth, and how you think about the impact, of your innovations. And so that was the question we asked ourselves as a company. If, we advanced our conception of how we can, sorry, if we expanded our conception of how we can advance health equity, not just limiting it to philanthropy, but embedding it in the business, just think, what we could achieve. And so that was the impetus, for building a new health equity team, for developing a broad enterprise-wide health equity strategy, that different areas of the business, were able to, kind of take on, and own and drive, within their own departments and divisions.
Yeah, and I think that that strategy has been very successful. Looking at the outcomes that it's out there. Eh, one other issue that has taken a center stage, especially in the US, is the issue of diversity, equity, and inclusion. Unfortunately, people have misconstrued it. um, but in your opinion, what do you think, or what do you envision for the future of diversity, equity, and inclusion initiatives in the US? Um, and how do you think these efforts will evolve in the coming years? It's quite scary. So
Mhm.
recently, I think MIT released their data on admissions following the Supreme Court's
Yeah.
ruling, and the intake or the enrollment of all
Mhm.
minority groups
Mhm.
have decreased
Mhm.
with significant impact on
Yeah.
uh, black and
Mhm.
other
Mhm.
minority groups. So
Mhm.
what do you really think is the direction
Yeah.
of DI initiatives?
Yeah. Yeah. No. So first of all, the fundamental principle, that everyone, irrespective of their differences, irrespective of what race they are, sex, gender, sexual identity, zip code they come from, religion they practice, country of origin, everybody should have kind of a fair and equal shot, at opportunity. And unfortunately, we're not all starting from the same place. And unfortunately, many of the systems and societies that we live in have actually been built to reinforce, these inequities. So even if you are starting from the same place, as you work through your life, the system, you may encounter different barriers and challenges that somebody else may not, and so I think that it's important for us to not just remember that, but to, make sure that there's a shared understanding of that. And I think one of the ways, we need to do that is to make sure that we, again, also have an inclusive, kind of understanding and conversation about what diversity is. Because I think far too often people, limit it to just one dimension, whereas, in each and every one of us exists multiple dimensions, of diversity. And so, it sometimes people like things to be, simple and boil down to, binary choices, but that's not the case. And so it's really going to take education, patience. For me, it's just basic, walk in the shoes of somebody else, and have that understanding, have that, open yourself up to that empathy. And I do think that hopefully, should kind of change the tenor of the discussion. Unfortunately, we live in a political society, and we, particularly in this country, we are where we are. Um, I think what has to happen is that we are still making sure that we are doing what we need to do, to bring everybody, to the table so that the decision can be made, which it is anyway, on identifying the best folks, for, those positions, for those slots, for those jobs, because everybody, is having a chance to compete for them. Um, what I would again say is that at the end of the day, it depends on decisions that, you, me, and everybody else, who are part of these institutions are making on a day-to-day basis. And it puts, uh, it really does emphasize that the responsibility is on each and every one of us, to make sure that each of our actions is actually being inclusive and not being exclusive.
Yeah, I think that's a powerful reference there. Hopefully, these initiatives would continue in order uh, to bridge the
Mhm,
inequity gap.
mhm, yeah,
In my previous episode with Dr. Ebere, we really talked about
yeah,
leadership in global health.
yeah,
And I know it's such an important concept,
mhm.
especially representation in global health. What do you think are some of the steps that will be necessary to ensure a more equitable distribution? of leadership roles in global health?
Mhm. So first of all, I'm so excited you were talking to Dr. Barry. I think, she's again one of these global health leaders, inspirations, for so many of us. Um, I think we have to bring intentionality to the table, which includes, making sure that people are aware of the data. I, for one, you can say that there are not enough women in global health positions, or there's not enough women of color in global health positions, or there's not enough women from the global south in global health leadership positions. But when you tell me that the number of women from the global south in global health leadership positions is about 3%, that you know that makes me think differently. That 2%, that's crazy. And so I do think making sure that we, again, are surfacing the data so that people actually understand the depth, of the issue is important. I think, and we play this as a funder role, people asking the questions, what's your board makeup? What's your leadership structure? What's your leadership makeup? Because I think when people ask the question, then people look, at their systems and their structure and their representation, and they ask themselves, why does it look like this? Is it just because this is the way it's always been? Is it just because, this is, the easiest thing to do? And while, it may be a little bit harder, or it may take a longer time, or it may mean you change your processes, you can do that and you should do that. And so that's about bringing intention, to this issue of making sure that there is more leadership reflects, again, the society we live in, and the communities that we're aiming to serve. I think the other important thing about leadership is that it's unfortunately it's not just relies on what you know. It's also about who because you may not be aware of leadership opportunities, or people who are seeking to fill leadership opportunities may not be aware of you. So what are the things we need to do to address that gap, of both being able to share those leadership opportunities with people so that they can raise their hand and say, consider me, as well as link the folks who are looking for leaders with, look at amazing talent over here, or look at this amazing person that, you may have never encountered, but she may be perfect, for the role that you're looking for. And so, whether you are playing that role of connector as an individual, so as an individual mentor, for example, or organizations that are set up to help link, whether they're leadership programs, fellowship programs, etc. I think those are really important, to help connect the gap, and close that gap that is preventing, I think, more leaders in this role, in these
Yeah.
roles. Mhm.
And I think you've kind of highlighted one aspect of how we can, bridge this gap. In your mentoring experience, how have you seen the role of mentorship and capacity
Mhm.
building for cultivating the next generation of global health leaders, especially
Yeah.
in
Yeah.
underserved communities or populations?
Yeah, no, I think it's essential, but it's actually not just mentorship, it's also sponsorship,
Yeah.
So you, in whatever role you are, you can say, look, I think this is a person who would be a great leader. This is why, and be an advocate, for that person, So I do think it's not just about mentorship, but it's also about sponsorship. I don't want to underplay, the systemic, issues that are preventing more equity in global leadership, including, something that I'm sure, you've probably experienced, how educational degrees from some countries, are seen as, not worth anything, even if it's the same degree from another country. And so, there are definite systemic, biases, including, how we value expertise, and what kinds of values we put on expertise depending on where it's coming from. And, we just need to continue to disabuse, folks, of that notion that, a degree from Ghana is not as much as, kind of a degree from, let's say John Hopkins.
That is a very good example of how people who already have an MPH and are applying for a PhD, and some schools would offer them another master's,
Mhm.
just to say that the master's you have is not enough to
Yeah.
get you into a PhD
Yeah.
program.
So we need to get away from that,
Yeah.
because, you see, there are no, there are no problems in, for example, taking nurses from Ghana. you know their qualifications are kind of accepted. So I think, these are the things we need to raise, around the differential value, that's placed on people's expertise and experience, and how the interplay of that, around global health equity.
Yeah, that's
Mhm,
important. And I think one other issue too, it's about how to bridge the gender equity gap. I know we talk about leadership
mhm,
in global health, but women face different barriers, especially Black women. So,
mhm.
what do you think are some of the strategies to address this gender equity in global health space?
No, so I'll share, another story. I have two daughters. I come from a family of five girls. In my father's family, there were three boys and three girls. My three aunts, never left the village. They had hard lives. They all died on average 20-25 years, younger, than their brothers. And I think that, many of the cultures that we come from, are patriarchal, have, kind of those, cultural inequities. And I think we need to own up to that. I remember when I first went back to work in Nigeria, we'd all be sitting around a table doing introductions: Dr. X, Dr. Y, Dr. Z, Marianne, you know. So, the one woman in the room was not referred to as a doctor, was referred to as her first name. And so, and obviously you can bet, I said something about that, but it is about kind of the mental maps we have about who our leaders are in society, and what they look like. And so I think it's just really, and sometimes this happens subconsciously. um, I think we have to, make sure that we are eroding, those old mental maps of who can be a leader, and who can be a good leader, based on, some of the cultures and societies, that we were brought up in. Um, and I think, you're doing this, you're giving me a platform, to, share my perspectives and my experiences as a global health leader. And I think that that's going to do something, to again expand people's mental maps of who can be a leader. So thank you.
Awesome, awesome. And it's an honor to have you on a platform, share your ideas and your experience. And I know for sure a lot of people, including uh you know women in public health, especially from Africa, are going to be excited
Mhm,
about this conversation.
mhm,
Um, let's
So
also
let
look at some trivia questions or
mhm,
some fun parts for
mhm.
people
Yeah.
to really get to know you. So in your throughout your journey from Nigeria to the US, who or what has really inspired you most daily,
Mhm.
and how do you stay motivated?
Yeah. No, I mean, that's simple. It's my daughters, and making sure that, they can grow up, in a world where, again, they can live their fullest lives, and not just them. I think, I don't want to be presumptuous, but when I think of, all the folks I went to primary school with or secondary school, or, all my relatives back, in the village, it's only by the grace of God, that I find myself here. And so how do I make sure, again, that, you know, health, does not become a determining factor, for not being able, to live your fullest life.
Having someone who looks up to you kind of really drives you to want to do the best or the most for them, especially when you've experienced,
Mhm.
life in a different dimension.
Mhm.
um so what are can you share one fun fact that most people will not know
I'm
about
not
you?
fun. You even warned me about this question, but I couldn't think of anything.
Okay. All right, so all right, so
I like to talk about my sisters who,
okay.
are world class athletes.
Oh,
They
okay.
they
Hmm.
they actually, I came to the United States. They kind of were in England and stayed there, but they all joined national teams and Olympic teams.
Mm.
And I'm not sporty at all. So that's a fun fact that I have sisters who have kind of reached,
Yeah.
um, national world championships in sports.
Elite level sports.
Yes,
Yeah.
yes, yes.
Yeah, that's good to know. Um, what are what are some of the things in your bucket list that you are excited to accomplish in the near future?
No, I think one, this new role, is something that I'm really excited about, to learn, not just about the impact the organization is having, its partners, the type of work that it does, but,
Hmm.
also the possibilities, for even greater impact, especially when you think about, the intersection of health and climate. I think that that's something that a lot of us are still trying to figure out. What we should be leaning into. And how we should be doing this, and how the connectivity between, the two sectors. So I think, for me. Um, my work is a very integral part, of who I am. It's not necessarily easy to kind of separate, separate the two. But if I would talk about, bucket lists, um, it really is about, making sure I'm carving out time, for friends and family,
Hmm.
and really, kind of developing, not just those relationships, but experiences that we can all share together.
Awesome. So if you're not working, what hobbies do you typically do?
So I actually like gardening. I love swimming, but it's not always easy to swim in New York City. But love gardening, as well. Yeah, as
Okay.
you can see from.
Yeah. Are there any movies or series that you've particularly enjoyed that you recommend?
No, I'm a cable news addict. Politics all the way.
Okay.
That's my soap opera.
Interesting.
Politics.
Yeah, there quite seem to be a lot of news and political discussions this cycle. Um, so what is what does your typical morning routine look like?
Ha. There's no typical, but one of the things I would say, and we didn't really get into this when we talked about female leadership, but
Hmm.
I mentioned I have two daughters, and so for the longest time, mornings were about getting them off to school, and making sure they had their lunches packed and their homework was done, and all of that of getting them out the door. Now that they're older, and one actually has just started college, it actually creates this opportunity around what do I want to do with my mornings? And right now it's about taking walks, and walking the dog, trying to get some exercise in, and preparing for the day. Mhm.
Okay. All right. So here is a big question. What's your favorite African dish?
Moi moi.
Okay. Okay. So let me ask another question. Nigeria jollof or Ghana jollof?
Yeah, yes, I knew you were going to ask that. I think it has to be Ghana.
The
Or let's just
Nigerians,
say Senegal.
my Nigerian friends will not be happy with this answer.
No, credit where credit is due. I
Okay.
also like a goosey soup.
Yeah, yeah, that's also
Mhm,
good. Yeah, that's
mhm,
agushi soup is also really
mhm.
good. I mean,
Yeah.
most of our uh cuisines are similar.
Yes. Yeah.
Nigeria and Ghana is
We're the
similar.
same.
Yeah, yeah. Okay, so final thoughts. What are some of your most proud achievements in your career?
Yeah. No,
And why?
I think again it's thinking about the trajectory, and the totality of my career. And I think one thing that I'm proud of throughout of all of it is, I've stayed true to my purpose, and whatever choices have been in front of me or whatever opportunities that have been in front of me, it's always about, is this going to drive further impact, for health outcomes globally? Is this a role that, I will be able to use, to drive those impacts? And so, I'm proud that I've been able to continue to do that, in so many different roles, across my career. And if I can share, one reflection with you, because as I mentioned, I mentor, a lot of folks, and at certain points during their career, people question, is what they're doing, actually making a difference? People question, should I go in this direction or that direction? And for so many mission-driven folks, it's not always an easy answer, and there's not always, it's not always an easy path. And so if I can share, these reflections, so what I have reflected on is, across this journey, I've come to recognize and to experience that our purpose is indeed our power. But it's not always easy to keep your purpose powered. There have been many points along the way where I've run out of fuel or I've lost sight of it when it got buried in the day to day. There've also been inflection points where I've had to admit to myself that I could no longer truly advance my purpose in the context I was in. And whatever the reason for, kind of losing sight of this purpose, I knew that I would need to find or even create new routes to my purpose. These crossroads can be tough, and finding or creating these new routes has never happened without inspiration or without help. And for that help I've been lucky to have a number of people in my life, some that I've met by chance, across a classroom, on a panel, um, on LinkedIn, where I've recognized a shared purpose. And when that happens, don't ignore it. Name it, claim it, celebrate it, nurture it, work it. Because although we all got here from different places and our journeys are unique, shaped as they are by our different backgrounds, exposures, and curiosity, as well as some serious hard work, luck, and sometimes privilege, we are the people who are going to keep each other's purpose powered, creating new pathways together and for each other. So now we don't need to leave it up to chance to meet someone we can change the world with. We are already engaging in this, across this platform. So thank you so much, for the invitation to join your podcast.
Yeah, this has been a very motivating segment for me, and I'm sure most viewers will take a very huge inspiration for this. And you've kind of answered the last question for for this podcast, like providing advice for young professionals, and you've kind of summarized everything very well. So thank you so much for honoring my invitation. I feel excited to share this conversation with our viewers, and we wish you all the best in
Yeah.
your new role. And we are definitely supporting you from Ghana and to some extent from Nigeria.
Go. Thank you so much. And I'm sure we'll find different ways to connect and collaborate, and
Definitely. Yeah.
really admire you for, creating this network and platform because a win for any one of us is a win for all of us,
Hmm.
and we can all support, and cheer on and champion each other. So thank you.
Awesome. Awesome. Thank you so
Mhm.
much.
Take care.